this video, we will discuss the anatomy of the orbit. The orbit is a pear-shaped bony cavity. The narrow posterior part of the spear, known as the stalk, corresponds to the optic canal. The orbit houses the eyeball along with its muscles, nerves, and vessels. Roof of the orbit. The roof of the orbit is formed by the lesser wing of sphenoid and the orbital plate of the frontal bone. The roof of the orbit separates orbit from the anterior cranial fossa and the frontal sinus. Because it lies adjacent to the anterior cranial fossa, any defect in the orbital roof can transmit cerebrospinal fluid pulsations, resulting in pulsatile proptosis. Lateral wall of the orbit. The lateral wall is composed of the greater wing of sphenoid and the zygomatic bone. It is the strongest wall of the orbit. However, because the anterior half of the globe protrudes beyond the lateral orbital margin, it is particularly vulnerable to lateral trauma. Floor of the orbit. The floor of the orbit is formed by the maxilla, zygomatic, and palatine bones. The posteromedial portion of the maxilla is relatively weak and is commonly involved in blowout fractures. Since the orbital floor also forms the roof of the maxillary sinus, maxillary tumors can push the globe upwards. Medial wall of the orbit. The medial wall is formed by four bones: maxilla, lacrimal, ethmoid, and sphenoid. The lamina papyracea, formed by the ethmoid, is extremely thin and perforated by multiple foramina. Because of this, orbital cellulitis is often secondary to ethmoidal sinusitis. Superior orbital fissure. The superior orbital fissure is a slit-like opening between the greater and lesser wings of sphenoid, connecting the orbit with the cavernous sinus. Structures passing through the superior orbital fissure. It is divided by the common tendinous ring or the annulus of Zinn into three main compartments: superior or lateral, central or intermediate, inferior or medial. The contents of the superior or lateral compartment are lacrimal nerve, frontal nerve, superior ophthalmic vein, and trochlear nerve. The contents of the central compartment are superior division of oculomotor nerve, nasociliary nerve, inferior division of oculomotor nerve, and abducens nerve. The content of the inferior or medial compartment is inferior ophthalmic vein. Inflammation involving the superior orbital fissure and orbital apex can result in Tolosa-Hunt syndrome. Patients typically present with painful ophthalmoplegia and features of venous congestion. Inferior orbital fissure. The inferior orbital fissure lies between the greater wing of sphenoid and the maxilla. It connects the orbit to pterygopalatine fossa and infratemporal fossa. Structures passing through the inferior orbital fissure. Inferior ophthalmic vein, ganglionic branches from pterygopalatine ganglion to maxillary nerve, infraorbital nerve, zygomatic nerve, and infraorbital artery and vein. To summarize, orbit is a pear-shaped cavity. Each wall has unique anatomy, and understanding the detailed anatomy of the orbit is crucial, as even minor pathology in its walls or fissures can produce significant ocular signs and symptoms. Fractures, infections, tumors, etc. also affect the globe position and movements.